Welcome Med-Peds applicants. I'm Gretchen Rickards. I'm the program director at ChristianaCare's internal medicine residency program. It's my honor to welcome you to your interview day. I'm really looking forward to giving you a brief overview of our medicine programs, but very briefly, a little bit about me. I have been the program director of the IM program for a little bit over 2 years. I've been at Christiana since 2016. My longer bio, I did my training. I had a little bit of a roundabout path to medicine, but I did my medical school at the University of Rochester, went from there to the military, and I was actually in the Army for 9 years prior to coming to Christiana. So I did my internal medicine residency at Tripler Army Medical Center in Hawaii, which was not terrible. Really enjoyed my time there. Went on from that to do a fellowship in general internal medicine and faculty development. And I've been in leadership roles in medical education for my entire career. So I think I have the best job in the world. I'm really looking forward to telling you a little bit more about our programs. And so at this point, I'm going to segue over to my slides. So again, welcome to ChristianaCare. Again, looking forward to giving you this brief overview of our programs. I like to start with missions, and maybe it has a little bit to do with my military background, but I think missions are mission statements are really important. So I'm not going to read it in total, but our program mission in the internal medicine program, and really I would say our family of programs. I know you will be a Med-Peds resident if you come here, but you will always be part of our larger family. So again, not going to read it, but we are very much about building future healthcare leaders in a supportive yet challenging environment that fosters clinical and academic excellence, humanism, professionalism, diversity and inclusion, scholarly inquiry, and wellness. I feel very passionate about that. That really is where it all starts. And so we'll start there. One thing that makes us special at Christiana is I'm the program director of the categorical program, but I've used the word already, I think, a few times, and I will continue to. We are a little unique in that we are a family of programs. So my program has 37 residents. The Med-Peds program has 17. There are 15 EMIMs and 4 transitional years. So in total, 73 residents, but we truly are one family of programs. And I think particularly the fact that we have combined programs here really adds to the depth and richness of the clinical learning environment. A big part of who we are too is we teach a lot of medical students. Our medical student program here in internal medicine, we have over 180 medical students rotate through our services per year. So hope you want to teach, because we will be doing lots of it. I'm sure Dr. Friedland already mentioned, but we are a branch campus of the Sidney Kimmel Medical College at Thomas Jefferson University, as well as the Philadelphia College of Osteopathic Medicine. We're the largest branch campus of those, and we also always have medical students from throughout the country rotating with us. Going to quickly segue into some curricular highlights. First, I'd like to mention the learner, manager, teacher model. So I'm sure you're familiar with the typical sort of teaching team format in internal medicine, where you'd have one resident and 2 interns, as well as multiple medical students. And we do have plenty of those here. You'll certainly have those opportunities. But during your second sort of into 3rd year, we also have some special teams called manager teams. And the idea behind the manager team is you working one-on-one with the attending to manage a census of inpatients. And what we really love about that model is it gives you a chance to really grow in your manager skills and your sort of autonomy before you move into those teaching roles. So again, it's very much about progressive autonomy, and we really love that idea. So that's the learner, manager, teacher model. Simulation training, I have a separate slide about this in a moment, but we do lots of it here. We have a 9,000 square foot state-of-the-art simulation training facility that we use all the time in our education program. So again, I'll speak more to that in a moment. Autonomy with responsibility is something I really like to highlight here. As someone who also trained at a facility that did not have a whole lot of fellowships, I think there are some real benefits to that. First and foremost, If you want to do procedures, you will get your hands in lots of them here. Our residents do tons and tons of procedures. You also, if you come here, I promise you will leave very, very skilled in the management of acutely ill patients. Our residents take care of manage over 4,000 RRTs per year, over 500 codes per year. So again, promise you will be very skilled and feel comfortable taking care of sick patients. And have a lot of autonomy in doing so. That said, there are always multiple levels of support behind you, both in-house and outside of the facility. So you will always have lots of support. We do have a night float system. I know people like to know that. So if you come here on the medicine side, you will do no 24-hour calls. And lastly, I'll just say, I think we have a very robust didactic program. Segueing in, I think anything that you'd be generally looking for in an internal medicine didactic program we have here. We have a morning report, we have a noon lecture series or core lecture series that's an 18-month rolling curriculum that is perfectly mapped to the ABIM board exam. So based in terms of sort of percentage of topics, as well as the specific topics, we are mapped to that. And it's an 18-month rolling curriculum that is also recorded, recognizing the fact that our combined residents in particular are often missing pieces of the lecture series. We have an intern report, a resident board review that happen weekly, as well as multiple sort of subspecialty conferences, including M&M, high value care, chest conference and such. And so I think, again, anything that you'd be looking for, we have here. I mentioned our simulation training, but I really can't say enough about it. Again, we have a 9,000 square foot state-of-the-art facility. There are model rooms there that look like any room in the hospital that you can think of. We use it extensively for code team training, rapid response team training, for procedure training. And we are always looking for sort of other opportunities to think outside the box and use it. So right now we have a medication reconciliation training that's going on in there. There are 100 task trainers there, so that you can go down, and many of them you can use 24/7. And so really, I cannot speak enough about our state-of-the-art facility. I know one question on people's minds is point of care ultrasound training. We are doing it. We've been doing it for many years. And so at least twice a year, a basic point of care ultrasound course is offered to all residents. We are looking in years to come to sort of expand on that and offer sort of multiple levels of training, but we certainly are providing that training already. Continuity clinic, I want to also talked a lot about already our inpatient training, but continuity clinic is a big part of your training here. So that's their ambulatory training. If you come here to Christiana, from day one, you will be the primary care provider for a panel of patients. Our primary care clinic is housed within Wilmington Hospital, which is right in the heart of Wilmington. We have actually been at that facility. That facility, Wilmington Hospital, is actually one of the original, really is the original site of our healthcare system. So we've been serving that population in Wilmington for a very, very long time. We've been there since the 1880s. It is, that said, an underserved population, an urban population, but we are very tied to that community. I've been there for a very long time. Despite being there for a long time, I will say it's a state-of-the-art facility. The entire facility where our clinic was upgraded just within the last couple of years. And every resident has 2 working rooms at any given time, which is really a nice luxury in internal medicine training. We at that clinic are also very rooted in team-based care. So you have one dedicated medical assistant, or actually a group of dedicated medical assistants that will be with you all the time. That's nice because you won't always be in the clinic, but you're always a primary care doctor. So it's nice to know who you're reaching out to and it can help out with your patients. We also at our clinic have numerous embedded services. So things like embedded behavioral health, pharmacy. We have social workers. We have a resource called the health guides, and what they do is help out with any kind of financial burdens that your patient may encounter. So it's really nice to have all of those services right on site, because we really do take care of a very high needs population. There are a lot of social determinants of health, but it's really great to have all those resources right on site to wrap the care around our patients. Transitioning now, we've talked about inpatient training, outpatient training. Just wanted to speak to a little bit of our unique training opportunities. I won't go into detail here because you probably heard a lot about these already from Dr. Friedland, but in brief, can't say enough about our global health track, the leadership training that we have here. So that's that Lead R course, a 2-week sort of standalone course that's offered to senior residents. We also have what's called the ACT course, which is an advanced QI training opportunity. That's a 12-week master's level course that's offered twice per year. And we also have housed within Wilmington Hospital, an area called the Health and Technology Innovation Center. That is a sort of think tank hub where within Christiana, there's a lot of work being done using advanced technologies. So things like artificial intelligence, apps, other kind of advanced technologies to solve issues for patients and providers. If that is of interest to you, there are opportunities to do 2- and 4-week rotations there, which again, I think just speaks to some of the unique training opportunities here at Christiana. What I really just love about these is that all of these are over and above the standard training curriculum, but I think are things that are special about us. Diversity, inclusion, and health equity. I would be remiss if I did not mention these topics. First and foremost, I want to say that we are an anti-racist program and organization, and I encourage you, if you have not seen it already, to take a look at our anti-racism statement. In terms of program initiatives, we've been doing a ton and are really expanding all the time in this area because we are very passionate about this domain. So in terms of things that we offer already, we have book and journal clubs that we do in combination with other residency programs in the organization. We are doing a whole lot of work in social justice and particularly community engagement activities. If you haven't heard already, one thing that I think is special about Christiana is that we offer, as an organization, 1 paid day of service per year per employee, and that includes residents and fellows. And so one thing that we're looking to do this year is just to get all of our residents out and using those service days, and looking forward to engaging more with our community in that and many other ways. In terms of health equity initiatives, our residents across our family of IM programs are actually leading the largest QI health equity initiative in the healthcare system. That's a blood pressure cuff initiative that's running out of our primary care clinic, and really, really proud of that effort. In addition, we have so many educational opportunities in terms of grand rounds, large lectures, small group discussions. We have a health equity lecture series that is kicking off in January of this year. And so much, although I will say that I really personally consider that to be the basement level of what we should be doing, and we are doing so much more. I've personally taken a leadership role in this area within the institution, and I'm really, really proud of the changes that we've made in the organization just over the last 6 to 12 months. That has included a reinstatement of a scholarship program for students that are underrepresented in medicine, as well as twice annual large-scale mentorship events that we kicked off this fall. That's through a collaboration between Academic Affairs and our Office of Inclusion and Diversity. So much more is in the works, including there will be a second look for diverse applicants. So please keep an eye out for that. That will be happening in January of this year. Lastly, in this topic, I'll just say one thing that I think is special here at Christiana is that we also have what are called employee resource groups. So we are a very large organization. We're 13,000 individuals, but there are 10 special groups within Christiana called the employee resource groups, or ERGs. I like to think of this as a way of finding a smaller community within this much larger community. And as you can see, there are many here. So there's one called the Physician Diversity Alliance that is for physicians of color and their allies. There's a Pride group, there is a South Asian community, there's a Latinx group, one for Caregiver Interfaith Alliance, and so many more, as you can see. But I think that's something really special here. And again, a way to find a community here, smaller community within a much larger organization. Wellness. I'll keep it short and sweet, and please just know that wellness, I know, is a buzzword in medical education, but it's been a part of our culture here as a program and institution. Is really part of the fabric of our culture for a very, very long time. We offer 2-day offsite annual retreats. We actually just did our 2nd year retreat, which was fabulous, in Rock Hall, Maryland. We also offer well-being rounds, so that we have here at Christiana a clinical psychologist. His entire job is to be dedicated to the residents and fellows of this organization. And so on a quarterly basis, he meets with our residents, and it's your shared time to talk about your shared experience. There's no leadership there. There are no faculty there. It's just you and him kind of talking about your shared experience. And there's a curriculum woven into that. We have a very active resident wellness committee that is planning activities all the time. And there are numerous other institutional endeavors. One thing I want to make sure to highlight, again, if you haven't heard already, is about our parental leave policy. We at Christiana offer 12 weeks of paid parental leave. That is available to every member of the organization, including residents and fellows, from day one of your employment with us, which I think is really, really special. I can't imagine that you'll be hearing about that from many other organizations, but I think that benefit more than anything really speaks to the heart of our wellness culture here at Christiana. I'll round out with just a couple of pictures. This is our current 3rd year class at one of their retreats, our current 2nd year class at one of their retreats, and our current interns haven't had their retreat yet, but I wanted to share their photo too, because they're such an amazing group. So that rounds out my talk, but why train at ChristianaCare? I really think, I'm sure you've heard a lot already, but we offer truly superior clinical training, both on the inpatient side as well as on the outpatient side. We do offer those very unique extracurricular opportunities. We have a truly supportive culture that promotes diversity and wellness. It really is a great place to live and work. And I said it a lot, but I'll say it again. We really are one internal medicine family. So I thank you so much for joining us today. I wish you the best of luck. And if you have any questions, please don't hesitate to reach out to me by email or in any medium. I'm happy to be in touch. Best of luck and take care.